That's why I was sent to bring the Organs Not Coercion petition to the McDougall Centre here in Calgary, which houses Premier Smith's Southern Alberta office. Over 20,000 Canadians have signed their name to this list, which started at organsnotcoercion.ca, calling on Alberta to rescind the mandating or enforcement of these new COVID treatments as a barrier to equal access to healthcare.
What experts you talked to with regards to Sheila Annette Lewis? Yep. Thank you. She won't be taking any other questions. She just said she would be right back, so that's not true.
So you missed the media scrum?
Well, the guy said he was going to ask a last question. He didn't even look at me. I tried to get his attention. Is this the same treatment she gives to Sheila Annette Lewis?
Sydney Fizzard for Rebel News. This new mRNA treatment known as the vaccine was introduced during the pandemic and praised by politicians as the only way to end the lockdown restrictions they themselves imposed. This new treatment saw an expedited review process of health and safety standards, and first dosages were injected not 1 year after the beginning of the pandemic.
That choice, which has consequences on putting our kids at risk, which has consequences at having us risk more lockdowns because they haven't chosen to get vaccinated yet, that there will be consequences for those people in not being able to go to a gym or a restaurant, not being able to go to a movie theater, not being able to get on a train or a plane.
The shot was imposed on every single Canadian as a means of accessing anything from employment, travel within and outside of Canada, and even our ability to dine at a restaurant or attend public events. Everything in life was determined by vaccination status, even access to healthcare. The pandemic ended and vaccine mandates were lifted. At least that's what they would have you believe. Most restrictions were lifted. But to this day, every single Canadian is now at risk of being denied life-saving surgery unless they're up to date with their COVID shots and boosters. Here in Alberta, Sheila Annette Lewis, who is suffering from a terminal condition, requires an organ transplant to survive. Alberta Health Services contracted doctors refused Sheila and said she and her family would now also have to get the shot and boosters for COVID if she wanted this life-saving surgery. Ms. Lewis refused, citing safety concerns and later her already acquired natural immunity. With legal support from Umar Sheikh of Sheikh Legal, Ms. Lewis was able to come to a satisfactory deal with AHS and doctors involved after pursuing a medical malpractice lawsuit against them. When they came to terms with Sheila Annette Lewis, it was made confidential, so we don't know what they provided Sheila, but what we do know is they didn't walk away scot-free. If they hadn't done anything wrong by denying this life-saving care over a COVID shot, they wouldn't have come to a deal like they did. This proves not only is it those being denied access to life-saving healthcare and their families that think there's something wrong with these denial of treatments, so too does Alberta Health Services and their contracted doctors. And it's not just Sheila Annette Lewis. There are others currently who have been denied this life-saving care here in Alberta. And truly, it is only a matter of time before you yourself may need to be faced with these circumstances. Denied life-saving care from your doctors because you weren't fully up to date with the latest boosters as well. The Canadian Military Tribunal recently ruled compelled vaccination may be a charter rights violation, and a senior Health Canada official who approved COVID jabs called underreporting of adverse offense a well-known fact. And the payouts for vaccine-injured Canadians is now growing beyond 7 figures. It's more than fair to ask why practitioners are still allowed to deny service based on new COVID-19 shots or mRNA treatments, leading to the deaths of an untold number of Canadians. That's why I was sent to bring the Organs Not Coercion petition to the McDougall Centre here in Calgary, which houses Premier Smith's Southern Alberta office. Over 20,000 Canadians have signed their name to this list, which started at organsnotcoercion.ca, calling on Alberta to rescind the mandating or enforcement of these new COVID treatments as a barrier to equal access to healthcare.
I'm here to drop off a petition for the Premier's office or the executive.
I can take that here.
Yeah, appreciate that. I don't know who would you be able to hand it to? I just want to make sure that it does get passed on.
I will give it to the Premier Secretary. How in the world could such a small group of people with limited resources change world history? But in fact, that's happening, and it's the power of the truth. The truth is like kryptonite.
Healthcare isn't in some sense working very well. Foster Coulson is thinking about this. He's got a new company, an online healthcare platform called the Wellness Company.
Telehealth company called the Wellness Company.
The Wellness Company.
The most popular product is the detoxification supplement that features nattokinase. Nattokinase is the only enzyme that we're aware of right now that dissolves the spike protein. Spike protein is loaded in the body with the COVID-19 infection and definitely with the vaccines. We've been completely accurate on the spread of the virus, early treatment, on the deficiencies in hospital care, and now the deaths that are occurring after vaccination. This is a human outrage, and it's occurring at the end of a hypodermic needle. Isn't it interesting? Natural substances combating this man-made disaster.
Smith's office received that petition and has the power to do something here in Alberta to secure equal access to healthcare for the unvaccinated and those not fully up to date with these new age treatments. One can hope Premier Smith will seriously consider doing right by the people of Alberta. But this isn't just a provincial issue. Canadians across the country are being denied access to life-saving surgeries. Joannie from Quebec is one of those people who, even though the pandemic is over, still is being denied a life-saving organ transplant because of her COVID vaccination status. She remains fighting for her life as time runs out to perform the transplant she needs to survive. You can find out more about that story at savejoannie.com. For some, like Garnet Harper, who required a life-saving kidney transplant to survive but was denied over his vaccination status, it's already too late. His family, wife, and children are now left with his passing and only the memories of the man they loved. It's time to end this coercion. Canadians are dying because of their politicians who have either refused to look at the science behind the COVID shots or simply don't care. That's why we wanted Premier Smith to see the names of over 20,000 people who signed our petition at organsnotcoercion.ca to put public pressure and let them know that even though they want to forget about their actions during the pandemic, we have not. That's why we expanded our Organs Not Coercion petition to a national level. Because of course, this isn't just an Albertan issue. This is a national crisis. Big pharmaceutical agencies like Pfizer, who would have those who refuse their drugs and their treatments be financially and socially crippled, have contractually swayed our politicians and doctors into refusing tax-paying Canadians life-saving care.
The Greek Prime Minister the other day, and he told me that they put a mandate. Actually, they put mandate if you don't get vaccinated and you are above 60 years old, 100 euros per month penalty.
It's a fine.
It's a fine. That's how it
Delta
works.
Airlines. In any event, there's pretty clear consensus here on this.
Yeah, it is. Because they work. I've seen it. Even at Pfizer, we had to make a mandate to ask our people. And although we were at 90%, but this 90 was not moving. And it moved to 97%.
You got it up to what?
97. Vaccinated. So it's a very big deal.
It'd be more valuable if you had an infection-blocking vaccine. I mean, the idea of checking if people are vaccinated, if you have breakthrough infections, what's the point?
They have begun issuing death sentences for those who do not take their shot. Add your name to the petition at organsnotcoercion.ca. Tell our government this is not okay and it will not be forgotten. For Rebel News, Sydney Fizard. The fight isn't over. Every single Canadian not fully up to date with their COVID-19 shots and boosters is now at risk of being denied life-saving healthcare. This is why we've expanded our petition at organsnotcoercion.ca to call on the Canadian government to entirely end the mandating of these unneeded COVID treatments as requirements for real life-saving healthcare. To sign that petition, go to organsnotcoercion.ca.